As we move forward, we'll practice and improve together, learning as we go. We ask you to be ready and open to on-the-spot feedback. Our goal is to make our rounds more efficient and streamlined. To do that, I'll outline 3 general types of presentations and share a few pointers to guide you. These are not strict rules, but practical tips to help us stay on track. The last caveat is that your attending physician for that day has the ultimate say in how presentations are given. So with all that said, let's get into the 3 most prototypical oral presentations. There are essentially 3 types of presentations we'll encounter. The first one is what I will call a thorough presentation. This applies to new patients or those patients admitted overnight. It's a detailed presentation covering everything from HPI, past medical history, surgical history, family history, social history, along with usual objective data and your well thought out assessment and plan. With teaching mixed in, expect these presentations to take about 20 to 30 minutes. The next type is called a brief presentation, and as it sounds like, this is for patients who are stable and whose primary challenges are most likely logistical. For example, a patient on day 92 of cefazolin for endocarditis who's awaiting placement. For these, I, as the attending physician for the day, will often say, go straight to the plan. This implies to skip the objective and subjective details unless there's something new or significant, in which case feel free to explain those. In general, focus on the top 2 to 3 key problems. These presentations will take about 1 to 5 minutes. The next type of presentation is for most rounding patients. These are patients with just a few moving parts, but who are not brand new. Here's an example. Mr. Smith is a 65-year-old male admitted for heart failure exacerbation. Overnight, he had increased urinary output. He reports improvement in his lower extremity edema and improvement in his shortness of breath. He denies chest pain, fever, chills, and dysuria. His Tmax is 37, his blood pressure is 120/80, his heart rate is 70, and respiratory rate 20. He's satting 99% on 1 liter, down from 3 liters yesterday. He's net negative, total 2 liters. His standing weight today is 80 kilograms, down from 85 kilograms yesterday. On exam, no JVD was noted, no crackles on auscultation, no S3 was heard either. And his lower extremity edema is +1. His labs show potassium of 4, magnesium of 2, and a creatinine of 1. His chest x-ray this morning shows small bilateral pleural effusions, and blood cultures from, this is where you tell the date, are no growth to date. For assessment and plan for his acute on chronic heart failure with reduced ejection fraction in exacerbation, I'm increasing his Lasix from 40 milligrams IV daily to 80 milligrams IV twice a day, and I also added metolazone 5 milligrams once. His repeat echocardiogram is still pending. I would like to continue his telemetry and monitor his electrolytes closely, and since I'm increasing his diuresis significantly, I ordered labs to be monitored twice a day. This type of presentation will likely take about 5 to 10 minutes, but a couple things to note on this, because I hasten to add that I chose to discuss the first problem for the purpose of this discussion, but remember that you should discuss what you or your team decides is important, which would probably be around 3 to 4 problems. Note that what I chose to report in the subjective and physical exam was not exhaustive, was curated based on my path of clinical reasoning. You should feel free to report whatever you think is pertinent, and this will look different based on your stage in learning. In closing, I want to emphasize that throughout rounds, we'll adjust as needed and focus on efficiency without compromising care. Remember, what I just described are loose guidelines, not rigid rules. If something significant changes or you feel a patient warrants a different approach, let your senior resident and/or attending know so that we can discuss it. Let's work together to make each week a productive and engaging learning experience.